Hello, I am Urologist Ömür Erdem Akkaya. Today I will give you a short video presentation about what is loss of sex drive. It is characterized by a decrease in the response to sexual stimuli and a decrease in sexual thoughts that pass through one's mind. Is the loss of sex drive a disease or a problem? It is not, under normal conditions, but when the sex drive is different between the partners, when the balance is different, when the desire is high in one and less in the other, it may be the beginning of a path leading to a relationship conflict or separation in the couple. So what are the most common causes? One of the most common causes is erectile dysfunction and impotence. In fact, those who experience loss of sex drive for these reasons are very lucky. Because when erectile dysfunction improves, loss of sex drive will also automatically improve. There are many other reasons and their treatment is more difficult. These are the reasons that depend on the person himself. What are these? The person may not like his own body image, he may think that his penis is small. I had a patient who was 50 years old and had a sexual life of 30 years. He spent 30 years thinking that his penis was small, and if he had actually eliminated this problem in his 20s, he would have had a much more colorful sex life. Or the person may have experienced a much more shocking event. It may have gone through an economic crisis. The person's mental state may be troubled, he may be manic depressive. He may be taking medication for depression. These increase the loss of sex drive even more. The person may have an obsessive compulsive state. He may not be able to get some thoughts out of his mind, or he may have thoughts that he previously considered right. The person may also have problems with his partner. He may have feelings of grudge, hatred, anger, and hostility towards his partner. He may not be telling this to her. The person may feel these feelings towards his family, towards his partner's family. One's partner may be reluctant. If the partner of the person is sexually reluctant, then after a while, loss of sex drive occurs in him. This is when these patients need to receive couples therapy or to receive treatment with their partner. Otherwise, the treatment success rate will decrease. Sometimes there are patients who come alone, and there are people who tell me, "My wife said don't come before this problem is solved." Some patients come with their partners to see how they can overcome this problem. His partner asks me the questions. This, in fact, is a much more fortunate group. Apart from that, if we look at singles or young people, porn or masturbation is one of the reasons for sexual reluctance. Because as long as the person exposes himself to sexually explicit images through porn, he becomes insensitive to sexual stimuli in his normal life. And these do not cause an erection or any sex drive in the person. In this way, when you do this with masturbation, it develops a conditioned reflex. And the patient develops a loss of sex drive. We say it especially to young people because it used to be very difficult to find porn material, but now it is very easy. I have said this in other videos. When it comes to the treatment part, as I said, if we can reveal the cause, there is a cure for sexual reluctance. But I can say that it is a little more difficult to treat than other sexual problems. That's why I think it is necessary to get professional support. If the person receives support in this regard, both medically and in terms of therapy, his life can be much more colorful. Thank you for listening, best regards.